So as the new patient at a PhysioMed clinic, one of the first bits of advice you're going to be given is to foam roll on a daily basis. So our analogy is seeing a massage therapist is like going to a dental hygienist, but foam rolling is like brushing your teeth. So foam rollers come in all different sizes and densities, so that anybody can benefit from foam rolling. And the benefits include everything from breaking up adhesions and knots in our muscles, improving blood flow, improving performance, all the way to de-stressing our nervous system and allowing us to sleep better. So I'm going to demonstrate a quick foam rolling sequence. We're going to use a rumble roller here, a dense roller with spikes on it actually. And we're going to lean back so you can start by foam rolling our upper back. So I'm going to let my head rest in my hands, and I'm going to roll from my shoulders to the bottom of my rib cage. And we're going to do this as many times as we need. I can start with just 5 or 6 passes. I can use at least 10 or 20. I'm going to roll on this until I feel like I'm making a change in my body. My head is part of my spine, and I'm keeping my spine parallel to the floor. I'm not curling my head in and making my posture worse, because the number one rule rehabbing at PhysioMed is we never voluntarily do anything that makes our posture worse. After I've done rolling out my back, I'm going to come and sit up on top of the roller. I'll bring one foot up across my knee and shift my weight onto the roller, onto my hip. And I'm going to start to roll out our glutes, or I'm basically rolling out my butt cheek. I'm going over the back pocket. Some of you may find this to be very, very, very tender and sensitive. That's very common to feel sensitivity, but as we foam roll more, we're not going to feel any discomfort with this at all. It's normal not to feel pain when we do this. Again, I'll do 6, 8, 10, 12 passes, whatever I need to do to feel like I'm making a change, and I'll compare one side to the other to see if I have any asymmetries. Once we've done our hips, we'll step one foot all the way over the other leg. I'll put both hands down behind the roller. I'll push off of that top leg, and I'm going to roll out my IT band. If any of you are runners, or you know people who are runners, you'll hear them complain a lot about IT band problems. After I've rolled out my IT band, we're going to continue to turn over. I can stay on my hands or come down on my forearms to roll out my quads, all the way up to the top of my hip. When we're done that, we would obviously do both sides. But we're going to finish off simply just by bringing the roller out to the middle of my calf. I'm going to grab the floor nice and strong, get tall through my spine. I'm going to pick my hips up, and I'm simply going to slide my hips forward and back as I roll out my calf. I can scour down the outside of the calf, find the inside of the calf, trying to seek out any of those spots that are tender. Again, it's normal for nothing to hurt, but it's very common for most of our new patients to feel all kinds of sensitivity and tenderness in some of these spots. So by starting to foam roll on a regular basis, you're going to help to relieve a lot of that discomfort, and it's going to help to maximize the treatment you get in the clinic. So if you find this information helpful, we encourage you to forward it to any of your family or friends, and we look forward to helping you reach all of your health goals.